A worn neck disc can squeeze a nerve and create painful arm symptoms. This pressure may cause tingling, numbness, or weakness affecting normal daily activities. Doctors consider surgery when rest, medicines, and therapy fail after several weeks of consistent care. A surgery called Anterior Cervical Discectomy and Fusion, ACDF, removes pressure from the spinal nerves or spinal cord. ACDF is often recommended when a pinched nerve or spinal cord compression on the MRI matches the patient's symptoms. A small front neck incision provides a direct and safe approach to the problem disc. Important neck structures are carefully moved aside to reach the spine safely. An X-ray guides the surgeon to work precisely at the exact disc level needed. Once the disc is exposed, the surgeon can see the area causing the nerve pressure. The damaged disc is removed carefully to open space for the irritated nerve. Any small bone spurs pressing on the nerve are removed to complete the decompression. The space is fully cleared so the nerve has open, pressure-free room again. A small spacer is placed where the disc used to be to support the spine. The spacer keeps bones evenly separated and helps maintain healthy neck alignment. A tiny plate and screws may add extra support while the neck begins healing. Together, the spacer and plate keep the bones steady so healing can begin. The incision is closed in layers to support clean and steady healing. The patient moves to recovery, where nurses closely monitor comfort and breathing. Upon waking, the neck may feel sore or stiff, which is completely normal. Most patients can sit, stand, and take short, gentle walks later the same day. Many people return home the same day or after one comfortable overnight stay. Arm pain often improves quickly because the nerve finally has the space it needs. Some people notice mild swallowing discomfort for a few days as swelling calms. The voice may sound slightly hoarse at first, but it usually improves fairly quickly. Resting at home with short walks and good posture supports steady healing progress.